How are we doing, folks? You're very welcome to this short presentation on the ACL rehabilitation pathway that we have here at Resync Physiotherapy. This is just going to be some basic information about what we do in the clinic, how we treat our ACL clients, and what pathway they go through to get back to sport. A lot of people end up getting confused about what they need to do in order to get back to sport, and what is good and what's good enough. In other words, how much strength do they need? How fast do they need to be? And we're trying to close that gap in the information that gets out to athletes, and hopefully this short presentation will be able to help you along. Okay, so getting the basics right sets the foundation in place for a successful rehab program. We're all about doing the basics extremely well. If you don't have the basics, you don't have a good foundation. So therefore, a good foundation in strength leads the way to be able to develop speed and power after surgery. So I'll just move a couple of things out of here that are sitting in the way there for me, and I'll just move my head out here as well. Okay, so what it takes to really recover after surgeries, people fail to realize that surgery is a big thing that your body has to go through. There's a surgical incision, there's a graft taken out from another muscle or from another tendon, and then that's reinserted and wound around bones in the knee to be able to stabilize it. And it's a substantial surgery, and people think that, oh, okay, I'm just having surgery, but when you actually think about it, your body is going through an awful lot. So after you've done an ACL injury, the first step would be initially to get a diagnosis. But then you're trying to reverse engineer what that pathway looks like from having the surgery to going to the physio, when to start the exercises, what I need to do to be able to get back to running, what I need to do to be back in playing sport. And all of that, being able to verbalize that to an athlete gives them a little bit more confidence that they have a structured plan and they know what metrics they need to hit in order to get where they need to be. So for example, when most people come out of surgery, they're given a couple of exercises, go to your physio in 3 to 4 weeks. They don't have an awful lot of time spent with a surgeon, so you don't get able to ask the right questions that you may have thought of when you're not in that appointment. And that's where having our pathway and a structured plan ends up relieving any of that anxiety that is caused by not having that information. ChatGPT and Google are great, but unfortunately it's not able to apply context, and everybody's ACL rehab is different. Everybody's experience of ACL rehab is different. And regardless, where you might see athletes that will come back after 6 months and some of them might never come back at all, it really depends on the ability to do the exercises, where you get your confidence from, and what are the barriers to the rehab. So the goal of today is to help you understand what recovery should look like and how you should be able to progress it in a structured fashion. So after you have the ACL surgery, so they've got the graft, they've imagined your knee is a fist like this. They drill in towards this side, and they drill in towards this side, and they put in the graft and they stabilize the knee. That graft needs time to incorporate into your body, which means that when it goes in, it's mainly tendinous, but over the course of maybe 11 to 12 weeks, that tendinous graft tends to remodel itself more into a ligament. And over that time, you are beginning to get back your range of motion, get back your strength, and start to feel a little bit more confident on that knee. So straight after surgery, there's going to be an awful lot of swelling, there's going to be an awful lot of pain. And what happens with that swelling is that when there's a lot of swelling in the knee, you have something called arterogenic inhibition, which means that the swelling in your knee is a protective mechanism from your body, and then your body is telling your quads not to work, or your hamstrings not to work, to try and protect the knee. Now, if you've had a patellar graft, what we know from the literature is that those quads tendons take an awful long time to come back and start to work as efficiently as they had done before, because they're still in that protection mode. So if you're taking a lot of tendon and bone from that patellar tendon, those quads are going to be inhibited for an awful long time. And even if you're having a patella tendon or you're having a hamstring tendon, those muscles are still going to weaken significantly. Your quad strength will drop. Your movement patterns changes because you don't want to bend that knee forward. You want to protect it, so you're trying to keep it nearly as stiff as possible for protection. And then and what we have to do as physios is to try and get you to load that knee in a confident way. Yes, it is going to be a little bit painful, but again, we're applying the context: how much pain is too much pain, and what kind of symptoms should we look out for in the 24 or 48 hours after we've done exercise. But the key thing that we try to get across here is that will only get worse if you don't move the knee. A lot of people have this perception that, oh, I'll protect the knee, it'll get better on its own. That's not the case. Your nervous system needs a little bit of stimulus to be able to allow those muscles and those tendons to stretch, to feed back to your brain, to kind of go, okay, hold on a second, these structures were painful, but now we're able to tolerate a little bit of load. I'll reduce down the sensitivity of the structures around it and therefore reduce your pain. That's why you feel better after exercise. That's why you feel a little bit more confident after you do the exercises, but then it reverts back into that protection. And the more you rinse and repeat that, then the easier it starts to become. So the biggest deficit after an ACL surgery is going to be your quad strength, which is often going to be 30 to 50% weaker after surgery. The quad strength is, imagine what we have to look at from a sports science perspective is you've we'll start with two different types of forces. We have vertical forces, which is going up. We have horizontal forces, which is going forward or going backwards. And what we want to be able to do is be able to use our quads for the vertical forces and then be able to use our glutes and hamstrings for the horizontal forces. So the basic movements that you need to do are walking and stairs. They're all vertical forces. So therefore the quads has a massive impact on how that works. Then when you go to sprint and go to change direction, when you go to sprint and accelerate, then your hamstrings and your glutes will come into it. So the first protocol is always going to be trying to get those quads to work, which, as I mentioned previously with the arthrogenic inhibition, can be quite difficult in the early stages of the surgery. So again, we want to set up a foundation whereby those quads are beginning to fire independently and they're getting the right stimulus to be able to build muscle from that point after the surgery, that you're able to when the pain is starting to be a little bit less. Okay. Backwards. So when you're looking at getting back into sport, it is interesting to look back at the literature, and they have looked at thousands and thousands of people, and some of the articles have popped up a couple of these interesting numbers. So returning to sport is obviously the big one. That's the end goal. People want to get back into sport, but that line needs to be defined, and it's defined as achieving the pre-injury levels of sport participation as defined by the same type, frequency, intensity, quality of performance as before injury. The important part there is frequency, intensity, and quality. A lot of people can get back and run a 5K, but that doesn't mean you're going to be able to do it consistently. And what we want to build after surgery is a robust knee that's able to tolerate the training sessions week in and week out. If you have a strong knee, but it doesn't have the endurance, it hasn't been exposed to a lot of endurance work, you're going to be able to produce those forces, but you're going to fatigue very, very quickly. And then as you fatigue for the longer training sessions that are like an hour and 20, then it's going to take that knee longer to recover. So if you train on a Monday and then it takes that knee 3 or 4 days to recover, you're not getting to training on Wednesday, you're getting to training on Friday. So with your knee properly recovered. But most of the time you need to be able to manage the intensity of each training session, the duration of each training session, in order to promote and not overload that knee so it's taking so long to recover. Returning to pre-injury levels, that would be defined as your basic strength. Like what were you able to do before the surgery that you're able to do now? And then lastly is actually returning. A lot of people who return to sport at 81%, but then returning to your pre-injury levels is how much strength and acceleration and deceleration do you have and how confident you feel on that, because there is a psychological aspect to surgery whereby there is that fear factor that you will re-injure it, or you will or the graft will fail, and then you're constantly subconsciously walking around in that knee still trying to protect it. And we can spot those as soon as we do a basic movement protocol. And then lastly is returning to competition. So that's, have you got back to competition levels? So we would classify as in 3 different stages: returning to activity, returning to sport, returning to performance. Your performance then would be returning to competition, and that's only 55% of people. And we've looked at the literature and we've started to kind of figure out that even though we do exercise programs and we were able to build a little bit more strength, it's multifactorial when it comes down to ACLs. You have a confidence level, you have a strength level, you have a movement capacity, you have to be able to rehab all the different aspects of playing sport: jumping, landing, twisting, turning, acceleration, deceleration, change of direction. So if you don't expose yourself to each one of those in a controlled manner, you're not going to be able to do it in a controlled manner in competition or in a game. And that's where we really try to have this extended pathway, whereby it's not just a time that you have. It's not just, I'm 6 months after surgery, I need to get back into sport. It's not like, I'm 9 months after surgery, I should be back in sport. And then if it's 12 months after surgery, you're saying to yourself, well, geez, I'll never get back into sport. That's not the case. There is certain metrics that we know you need to hit from a strength point of view that are relative to your body weight. And we have that data, and we consistently test with that to make sure you're on the right track. So as I said previously, it's progressive progress, so it's a progressive process. So the first couple of weeks are just going to be, the first couple of weeks are just going to be a recovery. Your body's gone through surgery; it needs a little bit more time to be able to recover from that, and let those tissues heal. But also, it's important in this aspect of that a lot of people will start to pull back on their calorie intake because they don't want to gain weight. But that's actually, you should be doing the opposite. You should be increasing your calorie intake by 200 to 300 calories, because your body is actually trying to repair itself. It's looking out for more nutrients and amino acids to be able to repair those soft tissues from the surgery. And if it's not going to get them from your diet, it's going to pull it from another source in your body, which is your own muscle. So what will happen is you'll end up with a net loss of muscle. So it is important to look at your nutritional intake pre and post surgery, and especially in the first 48 hours after surgery. You should be getting a lot more calories, a lot more nutrient dense foods into you, so your body has those amino acids to be able to repair itself. Then once you have the recovery phase, so after about 6 weeks, you should be having a good bit of confidence on that leg. You should be out walking, and then we start to reintroduce some strength building. So the main portion here is we want to try and restore the full range of motion in that knee, and then we want to try and load that knee into that full range. And that does take a considerable amount of time to be able to recruit those muscles, but also allow enough healing so that graft is able to integrate, and also the graft is able to integrate into the knee, but also that graft size that it was taken from needs time to heal and rebuild as well. Then the next stage is going to be the runner preparation. So running is a skill, and you need to have a certain amount of strength in order to run. And as I said, running is a vertical force, so you're going to use a lot of your quads. And there's another muscle in your calf called your soleus, and they are two of the main muscles that apply the driving force into in a vertical fashion. So having enough strength first will then lead the way to be able to retrain your running technique, because running is a skill. So having enough force to be able to have foot to be able to land on the ground and absorb it, having enough tension in that leg to be able to jump again from another foot, which is what running is, and then having enough control in around the hip, the knee, and the ankle to be able to allow that whole limb to work as one unit and transmit those forces from your foot to your knee to your hip and propel yourself forward. And then finally, once you've got that running preparation, you've got your gait your gait back on track, and we've started to expose you to some change of direction movements, then we're looking on to performance. And your performance is all about, right, we've built a strength. Now, how quickly can we produce that strength? And how quickly can we absorb strength from jumping, landing, twisting, and turning? And then finally, you have your skill aspect, which is your return to sport. So can that knee function, number one, at speed, number two, without you fully concentrating on your knee? So you need to be able to execute other tasks, such as kicking, passing, and jumping and reading the game. And that all becomes down into that knee becoming more automatic. In the early stages, all you're concentrating on the knee. On the later stages, we're concentrating on, do you have that control in that knee while you're completing another task? And they're all different steps that we need to take in it, and they need to be integrated into your program. Sorry, the last point on that is a lot of people will do a lot of exercises, but and unfortunately, in order to build muscle, which a lot of people post-surgery won't understand this because they've never been in this situation, the intensity of the exercise to build muscle is completely different than the intensity of the exercise to maintain muscle. And that means that we need to establish what is the capacity of that quad, how much load can it lift. We have a calculation to, let's say, look at if you can lift 100 kgs, let's calculate it and do reps and sets at 70 to 80 to 90% of that, or of that max lift. And then we know that exposure to those intensities, number one, recruit the larger motor units in that muscle to be able to get it to fire and to get it to work. And then also you create enough mechanical stress and tension to be able to build that muscle, so the muscle gets bigger itself and is able to produce more force. So the important stage is really, really important for us is getting the foundations right. The first 0 to 6 weeks is recovery, but then 6 to 16 weeks, you want to have a good structured program whereby you're restoring your quad strength, you're building your hamstring strength, you're strengthening your calves and your hips, because they are all part of that lower limb that needs to work as one unit for you to be able to get back into sport. And then finally improving your knee control, and then again prepping you for that running phase. And each one of this always is going to start with some testing to see exactly where you're at. So these are a couple of examples of a couple of exercises that we will do here. We'll have people into a lot of deep knee flexion, so you're able to gain more trust in that knee. A lot of people want to come away from those positions because they're afraid of them. So the first one there is a split squat. The next one there is you're getting really down into your vertical forces for your deep, for your front foot elevated single leg squat. It really puts it into a very, very deep position. It helps you gain more strength around the hip and around the knee as you're trying to integrate both of them together. A staple then is just your wall sit on this third video here. Let's drag that back again. Trying to get that foot closer towards the wall so you get more knee flexion in there, really recruits those quads and getting a good position to be able to hold it there. And then lastly, on the last video, we're looking at sorry, I've gone way back there. On the last video, we're looking at controlling that into a little bit of movement there. So we're trying to get you to lunge back in, so there's a little bit more of lateral forces coming into that knee, but it's also driving through that glute, and it's also driving through that knee in that position as well. So just getting into knee flexion is a key component of it, and that's what we want to try and promote. Apologies now, my computer is just having a bit of an attack here. We're going to the next stage. We're looking at power and control. So what we're trying to do here in the first exercise is get that knee forward over your toes as the band tries to pull your torso and your hips forward. Again, a bit of lateral work here on this center video, whereby you're trying to generate as much force by pushing that ankle and that foot into the ground to be able to generate force through the knee and up into the shoulder. And then lastly, we're looking at a little bit of power and control rotation on this last video. Again, this is apologies. Where we're adding a little bit of rotational component. This is more of your end stage rehab, but you can get the idea whereby you need to have the power and control in that leg to be able to rotate forward, as running is a rotational movement as well. So we're all trying to integrate all of these exercises in together at different stages of the plan. Then we come on to our in order to be able to create a baseline, we need to be able to look at what are your metrics. So how much strength your quad is able to produce, how much strength your hamstring is able to produce, and then how much can you do what can you do functionally. So with a lot of these exercises here, you're trying to look at how the functional ones is how much depth can you get in that knee when you're driving that knee forward and trying to lower your body down towards the ground. And that will give us an indication of how confident you are loading into that deep knee flexion. It's one thing loading it in into the deeper ranges, but then it's another thing trying to be able to do it consistently and under pressure. So our more functional tasks, as we look at a counter movement jump here on our last video, whereby we know we're able to express a good bit of force with two legs, and then a single leg counter movement jump will help us look between asymmetries between right and left. And then these, as I said, there's no guesswork here. We analyze what your metrics are, and we're able to put these into a detailed report that you're able to see what's happening with it. So if we're looking at our single leg drop jump, which is the last exercise there, we have a number of how quickly you're able to get back off that ground, and it seems relatively even between right and left in this patient. And then the same thing is on your single leg jump, is where you have a pause at the bottom, is how much you're able to control that limb on the way down. But then if you start to look at it when you're working at speed, so your drop jump, when you're using two legs, there's what's happening here is there's a 33% difference between the right and the left leg of how quickly you're able to decelerate on one knee when you're landing on 2 feet. This gives us a metric. Your counter movement jump is how high you can jump. Inter-county players, we're expecting them to hit about 50 centimeters on that. So we're kind of middle of the road here. And again, we're looking at another metric here is how quickly people are able to absorb forces again on another type of movement. So drop jump here, counter movement jump here. All of these kind of give us a bit of an idea about how much force you're able to produce. And then this is our max force here for a seated knee extension. That's quite a good number, 769. So even though you have a good bit of strength in that quad, the problem is how are you actually able to absorb load is a little bit different. So it's a different strength quality that we want to look at. And all of these tests just give us those metrics to really laser focus our rehab into what you need to do and what you need to do outside of let's say a rehab class of or to be able to close the gaps between the deficits that you have. And we're able to look at these over time. So if we look at counter movement jump, 29.7 centimeters, and then we added 6 centimeters onto that, 5 centimeters onto that in a couple of months. So that's really, really good. We definitely, as long as we're seeing an improvement, then that's the main thing that we want, and our numbers are going in the right direction. And a lot of the time, these numbers will be around the level of consistency, the level of intensity, and all of that needs to be learned throughout the rehab process. We estimate that normally with an ACL rehab from about 6 weeks onwards, you're probably putting in about 4 or 5 hours work in it per week to be able to get the improvements in a timely fashion. And then that ends up being a lot. So that's nearly 3 1-hour gym sessions per day, or 3 1-hour gym sessions per week, plus 1 to 2 hours of recovery time, mobility, and just helping that knee start to recover in between the sessions, because it does take a lot out of it. So there is a lot to consider when you're doing your ACL rehab. That it's not just I need to get strong, I need to go to the exercises. It's the intensity exercises, it's the speed of execution, it's the control during the speed of execution as well. That's all very, very important. So what are common challenges I find with ACL is patients don't know how good is good enough, so what their numbers are. They have no metrics to guide their rehab, they're just doing their basic exercises, but they're not having a coach with them to be able to guide them of foot position, what the feel of the exercise is, what the goal of that exercise is. And if you understand all that and link it back to the metrics, then it makes more sense to the athlete. There's no guidance outside the physio session, so there's no support. They get a couple of exercises, they go in, they try them, they come back in, has it improved, has it not improved, you don't know because you haven't tested it. And then what happens is they end up kind of going, oh, look, I've done a bit of rehab, I'll let it fall off. Maybe I don't want to go back to sport, maybe I don't want to play at a competitive level. And they end up having a little bit of a failed rehab, or they give it an extra bit of time and then go, my knee must be fine, I feel it's grand, I'll go back and play sport. And then you kind of niggle on, you struggle on with it for a while, so, and you don't understand why. And that's where the extensive testing comes in, to be able to kind of go, right, you're good at this, you're bad at this is where we need to improve, and be able to create that program around it. And then the last final thing is that a lot of people are not exposed to the different movements that are very similar to their sport. Like, have they been exposed to like a max effort acceleration? Have they been exposed to a max effort deceleration? And has there been enough exposure to change of directions and improving that movement literacy so that they're able to, number one, be in a good position to prevent injury, which we want them just a little bit lower down to the ground. People that tend to stand up very, very tall with a straighter leg do have a high tendency to have more ACL injuries than people that are a little bit lower down to the ground, a little bit more of a knee bend in some of those cutting maneuvers that we try to expose them to. So there is all of these things that we can kind of integrate in together and demonstrate to the person that this is where their deficits lie. So every patient that comes into us begins an ACL assessment that gives us our strength deficits or movement control, the current stage of rehabilitation. So just because you're 8 weeks after rehab, you might be 8 weeks after surgery. That 8 weeks after surgery does not necessarily mean you have the strength to progress on to a program that is designed for somebody who's 8 weeks after surgery. You need to develop a little bit more strength, and that's why we divide them into an ACL1 and an ACL2. So our ACL1 is our foundation strength that starts from about 6 weeks, and our ACL2 is our strength and performance, which starts from about 16 weeks. We have considered a lot of the time we have people come in that are 16 weeks, but they have the strength levels and the control levels of somebody who's at 8 weeks. So therefore, we have to bring them back into that foundational strength, and that's where the testing lies. It's not just a time-based criteria. It's more about the strength metrics and also the psychological readiness to be able to load those knees into positions that you might previously have been uncomfortable with. And that's where that's why it's really, really important to have that initial testing to show where we're at. Otherwise, we'll be putting you into an area whereby you're not physically capable of doing the exercises, and I'll end up doing more harm than good. So so that's our ACL pathway. That's the reasoning behind it. This is what we do with regards in our ACL classes, which are run weekly, once a week. They're 60-minute classes, and we run them in blocks of 8 weeks. So you'll have your 60-minute class, you'll have exercises to complete at home, you'll also have your strength tests that will show you where your metrics are, and then we'll do a retest at the end to make sure that everything is going in the right direction. And some people, not surprisingly, might have to do 2 8-week blocks of it because they haven't improved in the first 8-week blocks in order to get the most out of it to go on to the strength and performance side of things. Is where the intensity really starts to ramp up. There's a lot more pitch-based running exercises. It's a lot more explosive movements, and it is a little bit more aggressive a lot more aggressive than just building your foundational strength. So we need to have people that are physically competent and confident in that need to progress into strength and performance. So thank you for listening. I understand that was 27 minutes, a little bit longer than what we're going for. But please reach out to us. You can contact us at the clinic. The email address is here to help at Resync Physiotherapy. Our clinic is located in Stepaside, Dublin 18, which is in South Dublin. It's about 5 minutes away from the M50. And if you're interested in us helping you out with some ACL rehab and doing some testing, please reach out and don't be shy. Thanks for listening.